Welcome to Think Like a Pancreas, the podcast, where our goal is to keep you informed, inspired, and a little entertained on all things diabetes. The information contained in this program is based on the experience and opinions of the Integrated Diabetes Services clinical team. Please discuss any changes to your treatment plan with your personal healthcare provider before implementing.
Welcome to Think Like a Pancreas, the podcast. I'm your host, Gary Scheiner, and I'm proud to kick off a series of podcast episodes to give you a chance to get to know our team on a more personal level. And I'm joined by two of our ACE clinicians today, Tavia Vital, who's a nurse and CDCES, and Kristi Piguayo, who is an LCSW and a CDCES. So welcome the two of you. Glad to have you here.
Thank you. Glad to be here.
Mm-hmm. Yeah, so we're going to talk a little bit first about your backgrounds and then get into some more personal areas involving diabetes and get some opinions you have about the rest of the team. It's going to be fun. I'll try my best not to embarrass anybody. Okay.
That's appreciated.
Yeah. So, hey, Kristi, start with you. What year, you remember what year you were diagnosed?
Yeah, actually, I just had my 25th anniversary, my diversary. It was June. It was early June of 2000.
Yeah, I used to get, I didn't know how to respond to people who congratulated me for making 30 or 40 years. And then I realized it beats the alternative. When you were first diagnosed, what were some of the management tools that you were using, Kristi?
When I was first diagnosed, I didn't totally realize this, but it was just as Lantus had come onto the market. So I was doing, I don't know if it was Novolog, Lantus. It's been such a long time ago. And then I transitioned to an insulin pump a few years later. But when I left the hospital, I was on Lantus and Novolog, and then the endocrinologist I was seeing transitioned me to the fancy 75/25, and I was on that for a few years, really.
Pre-mixed insulin as a type 1.
Yep, and I adhered to that, but it just ended up not offering the flexibility that I needed, and so I was transitioned to a pump. Well, I transitioned to MDI and then to a pump because I needed.
I was originally going to say you never got to enjoy the beauty of NPH, but with 75/25, you were on NPH not once, but twice a day.
Yeah. Yeah, I never thought about it like that, but yeah.
Tavia, you were diagnosed earlier than Kristi, right?
Yep, 1981, April 1981. So I was 2.5. And I still have a little flashback memory from that diagnosis, which I don't really remember anything else from that age. But we were in the hospital and they taught my mom how to do insulin injections with a syringe in an orange. And the day she was supposed to give me my first injection, there was a tornado. So they were taking all the patients and putting them into the central hallways of the hospital system. And someone comes in and says, "Quick, give this insulin injection to your daughter before we have to evacuate for the tornado." And my mom said, "No, you said inject, then eat. It's very important or she'll have a low blood sugar," not knowing what any of this means, right? And the nurse was panicking apparently and said, "No, you have to inject it quick." And my mom was freaked out and said, "I can't." And so anxiety won there. And we got to the hallway and I didn't have a fatal insulin injection the first time my mom tried, which is good. And then in the hallway, a lady was on a rocking chair and rocked on my big toe. That's what I remember. I remember sitting in a rocking chair with my mom and crying, and somebody had rocked on my big toe. I don't remember the diabetes part at all.
All with a tornado bearing down on you.
I don't know where the tornado was. I just know that there was a warning, which means somebody saw one in the nearby area. Yeah.
Were things flying around the halls of the hospital from the tornado?
They may have been, but I just remember my big toe hurt. So no idea.
You were 2,
We started on my mom. I asked my mom about this a little while back. They started me on diluted insulin of some sort. So mom had it diluted at home. And at that time it was animal insulin. I started with cow insulin and had giant welts and lumps and bumps and then switched to pig insulin, which ended up causing a lot of hard areas, like my legs felt like wood, like blocks of wood for most of my childhood. And at some point in time during my childhood, then there was, the recombinant DNA. We switched to good old NPH and regular. And I don't remember if we ever did mixed or not. So long ago. I just know that I had to take insulin in the morning and in the evening. I don't think I had to take a lunch dose while I was in school until it was, I think, Lantus and Humalog when I was in high school.
The NPH in the morning would, quote unquote, cover your lunch.
Right. I'm sure it did a great job. And I know I had to check my sugar. So I had to go to the office and check my blood sugar on a manual finger testing strip. There were no digital meters until sometime in later grade school. Then I got a digital one. I was still little, like young kid, but it was a big thing. It was a brown Tupperware box. I hated that thing. It was so ugly. It was huge. It was like this tall and this big. Can't even show you in my window how big it was. And it had the meter and the cleaning and the strips and the giant guillotine finger poker thing. That's what
being a nurse, you know what NPH really stands for.
What are you saying? You're going to make a joke, so you tell me what you think.
What does it stand? You know what it actually stands for.
Oh gosh, the protein. I don't remember right now.
Neutral.
I'm on the
zinc.
spot. I can't do it.
Neutral protamine hegedorn.
There you go. What he said.
But not particularly helpful is what we all refer
That's
to.
That's what I was waiting for. I could see the twinkle. I knew you had something up your sleeve.
Kristi, when you talked about how it didn't allow you flexibility, it is a rigid insulin to use.
At the time for me, I think what I was doing, I just started, and I was probably honeymooning for a while. So it worked until it didn't work anymore. And then I just really felt like I was failing at it. And I'm so grateful because then I moved to Chicago and I started working with Dr. Corcoran, was my endocrinologist. And so he just started to open up the floodgates for me, and the level of care just changed dramatically. And so I'm forever grateful for that. But I followed that. If I was told to eat breakfast, I was not a breakfast person. I found a way to eat breakfast. I followed it to a T. One of my memories of diagnosis time was test strips were not covered by insurance.
True. They weren't when I was diagnosed either.
So for me, I was that as a young adult, I got a test 6 times a day. Not all of them, you don't always get a full sample in it, right? Or it reads error, but somehow I'm adding up the math, right? And was having some emotional reactions to this brutal reality. And it was a pre-existing condition, so not covered by insurance for the first year. It was
nice. Tavia, when you mentioned the orange, that reminded me what I remember most about insulin syringes. I was a freshman in college when I was diagnosed. When I went back for sophomore year, I was diagnosed in the summertime, so I went back for sophomore year. My friends try to make light of it, and what we would do is I would take my insulin syringes and draw up vodka with them and inject them into oranges to make screwdrivers still in the rind.
So your friends didn't respond negatively to your diagnosis then? You won them over by...
No, we had fun with it because I try to keep, doing everything I like to. In fact, before dinner, the guys that in my suite where I lived, they would kind of bet on what my blood sugar was. And some of them would start asking me questions. They got smart. Like, hey, did you work out today? What'd you eat for lunch? Was it like all you can eat taco day? Because they didn't know my sugar would be higher if I ate that kind of stuff. So they'd all put $1 in and they bet on who could guess my blood sugar. And I had one of the early meters in the mid 80s that, took about, a minute and a half to do the reading, but it gave you something. I went home from the hospital with the vial of strips that had a color chart on it. You'd bleed on the strip and match the color change. And
Yeah, that's
Very
what we used
subtle
for
color
years.
changes between a 150 and a 250 and a 350, very subtle differences. So, nowadays we're really splitting hairs and giving insulin in micro doses with the pumps and even with the
Very
smart
different.
pens that we use now. So let's shift to today. Kristi, you're off 75-25 twice a day. How are you? What tools are you using to manage your diabetes now?
I use the Dexcom G7 and I use the Omnipod Dash, but I loop. A friend of mine helped me build the loop, and that's what I've been doing for the past 5 years. I built the loop in the middle of the pandemic in 2000 and what was that, 22? No,
20.
2020.
2020.
Right. 2020.
I
Yeah.
always remember COVID-19 is when it started. So 2020 is when it really hit
Right.
with brunt force.
Yeah. Yeah. So
So you're looping. Which insulin are you using?
I use Novolog. That's what my insurance prefers. So, and I do also use a Afrezza. I do that for
So
the
when do you use
postprandial.
Afrezza?
I use that inhaled insulin to help when I've got a squirrely blood sugar that's double arrows up, just to bring it down without a tail. That's a newer therapy that I'm grateful my doctor was willing to prescribe for me and let me play around with it a little bit. Another little tip and trick I learned from some of my friends at diabetes training camp that
It's a long, long way from 75-25, isn't it?
yeah,
I
I
would
mean,
say,
that's so long ago, right? Like I'm at the point now where some of that stuff, like I can remember when I was first diagnosed, hearing people say they don't really remember a time. And that's kind of where I'm at too, is I've noticed in the last decade or so, I don't really remember a lot of what that was like. But for a while, it was very fresh, very real, what it was like to not have diabetes and then what it was like to have
yeah,
it.
we used to have to make our life conform to our insulin program.
Right.
Now it's
Absolutely.
the opposite.
Right.
We live the life we want to live, and we make the insulin program fit that and match it. Ultimately, that's what we try to do. Tavia, how about you? What are you using to manage yourself?
I am using Dexcom G6 and I use Omnipod. I actually have a stash of Arrows pods, and some may or may not be expired, but they still seem to work okay. So I'm using them. And a Riley Link, and I use that to use a system called Trio, which is like Loop but different. It's another hybrid closed loop system that you can control on an app on your cell phone, and it offers a lot of flexibility and tools that help me manage my diabetes better. Once they're set up and fine-tuned, then it does a lot of work for me, which is why I like it.
Yeah. So are both of you still able to enjoy the foods you like and the activities you like and still manage your glucose?
Yeah. Yeah. Does it
What do you,
always work out? No.
yeah. Well, what doesn't work? What things challenge you still?
Well, I think lack of planning is my biggest challenge. So I like to do things spontaneously. So if I just eat a big lunch and then I notice the weather is nice on the weekend and I want to go do something physical outside, that's a challenge because now I have food digesting at who knows how long it's going to take. And the insulin is going to be peaking probably about when I'm ready to get out there. So that's a challenge that I face for sure.
Kristi, do you have an Achilles heel with your diabetes that still challenges you?
I love what Tavia said. I think for me, the place that I'm at in my life, and it's not always been this way. There were times that I was very erring on the side of obsessive about really trying to dial in my diabetes. But now, and conforming food to match that, now I'm at a place where I very much just want my life to be what is enjoyable to me, and all foods fit. And much to Tavia's point, I'll just clean up the mess with different, whether it's moving my body more or some Afrezza or hydrate or whatever, like whatever that is. But I no longer want to have this rigid relationship with blood sugars or food.
I love how you've learned to adapt.
Mm.
The adaption is key.
There's
I guess I
different
have,
seasons of life that you've got to focus differently sometimes with diabetes, right? This is not,
yeah.
but at the stage of life that I'm in right now, that's something that I am really protective of,
Yeah.
that my relationship to food and myself is.
My two big challenges, one is when I do go low, I can't stop eating. I mean, I preach to our clients night and day about proper treatment of hypoglycemia. I talk about that till I'm blue in the face, and I'm pretty convincing when I tell them. But when it comes to my own hypoglycemia, I am the worst. I just eat everything and anything I can get my hands on. And oftentimes it's not the kind of stuff that'll raise your blood sugar quickly. It's, as I said, everything and anything I can get my hands on. And I have not figured out a very effective solution to
I
that.
struggle with that too, where like I feel like with the tools that we have now, the hybrid closed loops, like I probably need 4 grams of something
You
to
don't
deal
need
with a blood
much.
sugar alone.
Yeah.
But like my body does not feel satisfied with 4 grams. So I've got like this little lovely soda that's nice because it's got a little screw top and I can, but
Yeah,
I
Tavia
have a
was
hard
showing
time.
off her glow gummies.
These are my favorites because you chew them for a couple of seconds. So the part of your brain that tells you you need to be chewing food, you get that. And they kick in fast. So I don't have that prolonged, I still need to eat more food to feel better feeling as often. Does it never happen where I do what Gary just talked about? Well, that wouldn't be true. But but most of the time, if I stick with those or I stick with Smarties, then I'm not inclined to eat more food. I get better faster and then I move on.
Yeah, I
But
know
like in the middle of
these
the night or late at night, man.
I know these glucose melts, I find work faster than anything else I've found. Liquid, solid, doesn't matter. These are quick. And if I use them, usually I'll just take a couple of these and I'm good. But then if I'm around any kind of food, and like you said, Kristi, it's not so much what treats the low, it's what satisfies me. When I'm low, food feels good. It's very satisfying to just keep eating. So that's the challenge. The other challenge is the impact of physical activity, because I work out in different ways on different days at different times, but almost every day I'm getting some activity. And the effects of that don't just occur during the activity, they go on well beyond that. So the more active I am, the more sensitive I am to insulin for a while. But the less active I am, the less sensitive I am. So it's a tough thing to adjust to, because every minute of every day, my sensitivity to insulin is changing. I think we need the software engineers to come up with an algorithm adaptation for how physically active you've been in the recent past, because I don't want to be thinking about that constantly.
I wish there was also an algorithm or some sort of I don't want more data streaming my way. That is for sure. Not with already getting 255 blood sugar readings a day, right? But I wish there was something for like adrenaline and cortisol, because I definitely will notice little bumps or spikes in blood sugars. I wish I knew how long, how much that was happening so that I could factor in my response as I'm watching my blood sugars change.
That would be a neat trick, Kristi, to figure that part out.
Yeah, for sure.
What do you both do to stay in shape?
I do right at this time of year. There's a lot of yard work and pool work, so I have my pool cleaning guns available now. Can't see them on the screen very well, but
we're talking arm muscles, not military.
Not military guns. Correct. Right. Yeah. Yeah. So that and walking regularly, those are my two big ones. And then swimming in the summertime, bike riding. But the ones I do regularly, walking and yard work and working on that dang swimming pool.
As an Iowa girl, did you ever have to do farm work?
I did not have to do livestock farm work. I did rogue beans. We decided I was too short to rogue corn, or detassel corn. So I rogue beans, where you walk through the rows and get out all the weeds that shouldn't be there with the hoe and some gloves, and try not to get bit by any spiders or snakes or mosquitoes. Yeah.
It sounds like a workout.
And I had no modern technology available at that time, no sensor, no pump. It was just Lantus and Humalog. And I think we knew that at that point in time, carb counting mattered. It was the exchange diet for a long time. I just brought a cooler with me, and it had regular Mountain Dew and Oreos in it. And every couple of rows, I'd just take some, and then I keep going, and then take some. Yep. That's what I did.
Mountain Dew and Oreo diet. I like that.
I was, what can I fit
Kristi, how do you
into
stay
this
in shape?
cooler?
I love that, Tavia. I'm definitely more active in the summer. I love gardening. I love being outside. I don't mind pulling weeds, just anything that moves my body. Bike rides has been really fun lately. We're in a new neighborhood, so it's been fun to go and explore. We've got some nice hills around us, so that's been good to feel that.
You're in Western Michigan, right?
Yeah. Yep. In the Grand Rapids area. I also love walking and swimming. I don't have great access to swimming, but I would be all over a pool if I had one, like Tavia does. But
nice. Yeah, so it's nice to lead by example. Hopefully our patients see how we benefit and follow. And we all have our specialties: nursing, mental health, exercise physiology in my case. But something we have in common, we're all certified diabetes care and education specialists as well. So why did you get into that field, and what do you like about working as a CDCES?
Word from our sponsor. Byram Healthcare understands that managing diabetes isn't one size fits all. With a full range of CGMs, insulin pumps, and diabetes supplies from top brands, Byram makes it easy to get what you need, hassle-free, shipped right to your door. And Byram's team of experts helps navigate insurance so you can focus on living your best life. Ready for better diabetes care? Visit byramhealthcare.com/podcast or call 866-692-8024 and select option 3. And now, back to our program.
Kristi, why don't you tell us first?
So I stumbled into it. My husband and I moved to this area moved to Grand Rapids from Chicago, and we thought we were going to be here very temporarily. And there was an acquaintance that we had that worked for the local hospital, and the first job that I had with the hospital was not a great fit. I was doing home visit, high-risk pregnancy, so it kind of overlapped with. But in my graduate program, I had no idea about anything in the medical field and psychology. But there was a position for a pediatric social worker, or a social worker in peds endo, in pediatric endocrinology. And so I applied. I was like, I didn't even know what that was, because I didn't know I saw a pediatric endocrinologist. I was diagnosed as an adult with type 1. So I spent the first 5 years in pediatric side, and then in the adult side, the adult wanted to grow something a little bit more sophisticated, and they recruited me to build the mental health part of that. And so it just kind of kept going from there. And really the credentials didn't necessarily mean a whole lot to me. I think it was just more about feeling seen, and the specialty area that I have just wasn't represented in my social work licensure. So I wanted this other one to show that I specialize in it.
Now the ADA has a whole directory of mental health professionals in the diabetes space. It's finally getting its just due after many, many years.
Yeah.
I developed my interest because I met a guy, literally. It was a few years after my diagnosis. I was having a lot of blood sugar issues. I had some serious lows because I play a lot of basketball. I was getting lows in the middle of the night after playing. And I went to a hospital class about diabetes. And I met a guy named Tom Kowalski, who was an exercise physiologist, and he also had type 1. And he was teaching everyone about things you can do to manage your blood sugar during and after exercise. And it just blew my mind. I mean, I had never heard at that point about self-adjusting insulin, about having extra carbs and things like that. And I said, I want to do this. This is what I want to do. I want to get good at it and be able to teach other people. So that's when I went and got my master's in exercise physiology and landed a job with the Joslin Clinic, and it kind of grew from there. Tavia, what got you started?
Sounds sort of similar to your story, Gary.
You
had
met
to
Tom
go,
Kowalski also?
well, except mine wasn't named Tom, but I was forced to go to a hospital-based diabetes education series of group classes in order to get my first appointment with the endo there when I moved to Colorado area. And I was really kind of salty and irritated of I'd already had diabetes for 25 stinking years. Now you're making me take work off and go to these classes. In one of the classes, the educator at the time, her name is Terry Ryan Turek. She worked at the University of Colorado Hospital, and now she's in Hawaii doing her diabetes educator goodness there. She was teaching the class, and it was time for a break, and she was checking her blood sugar and said, "Oh, I'm a little low." And I looked around the room, and nobody freaked out. Nobody was like, "Oh, do you need more insulin? Or should I call an ambulance?" Or all the things that, people who don't know anything about diabetes are inclined to say to you in that moment, which is super not helpful. And I thought, this is a clinic designated, at least in large part, to people who take insulin and have diabetes. And I want to do what she's doing. It would be so great to be able to, and I actually learned some things in the classes. So it was worth my time, even though I didn't know it was going to be. And I thought if I could give back to other people so that they could live well, I'm only here because I had smart doctors and smart parents that pushed the bounds on what you can and can't do. And somebody says you can't do it. Well, why can't we just do it this way? I think we could, right? And I could do this. And that's where my light bulb moment was. And so I went back to school to become a nurse so that I could become a certified diabetes care and education specialist. And they thankfully hired me in that same clinic several years later. And that's where I got my start.
Awesome.
When I think about, for me, I had no role model. I never met anybody that did what I wish so much there would have been somebody like me at my diagnosis or anywhere along my journey to come in and be like, just talk to me about any of the mental and emotional parts of diabetes. So that I think was a big driver for me when I didn't see any examples. Was I know what it feels. I know what it's like to not have, and I've worked with amazing people over my career, like as a patient, and professionally, but I wish there would have been somebody like me to talk to.
Yeah. And the patients that we work with, I love this work because we develop relationships with our patients that go on long term, and we really do get to experience the changes that they go through and the benefits that they reap from the work we do together. But there's also, there are their share of weird oddities that we have to deal with in our work. We used to think that our big challenge was getting patients to get their blood sugars down. Nowadays, I see more patients who are just suffering from so much hypoglycemia because I don't know if they're misinformed or misguided, but they feel like any high glucose is just killing them and they can't survive anything above normal. So helping them understand that low blood sugar is also their enemy and it needs to be dealt with. But Kristi, what are some of the strange oddities that you have to deal with in your day-to-day work?
I think the biggest, a lot of the conversations that I focus on with clients is helping reduce shame and a sense of failure around diabetes that are outside of range. and that blood sugars can fluctuate and they're not in any danger as well. Of course, we're aware of the risk of complications. We're aware of, right, like there is some level of danger that is inherent to type 1 diabetes, but I think a big part of my work I see is just really helping people either loosen their grip a little bit with how perfect they want things to be, because it just can wreak havoc in a multitude of ways. And or if somebody's really struggling to embrace it, reducing that shame as well to like help them understand this is how to stay safe. So it's really kind of coming at it from either extreme and meeting somebody where they're at and figuring out what helps them think about it in a way that
it helps them to see the bigger picture. I mean, we're in this for quality of life ultimately, and part of that is managing your diabetes so you don't develop health problems, but part of it also having a quality of life now where you're not being subjugated to low blood sugars frequently, and you're not obsessing over your diabetes and missing sleep and not enjoying the foods and the activities that you really love, because it just happens far too often. Would you agree with that?
Yeah, absolutely. Yeah.
Tavia, are there any odd, unusual things you have to deal with?
I don't know about odd, but I think maybe challenging when working with clients who are also dealing with other complicated health issues or complex, if not necessarily complicated, but complex health issues, such as undergoing chemo or radiation therapy, or someone who's going through getting eggs, the egg retrieval process and getting ready for IVF and going through IVF to try to get to a healthy pregnancy standpoint. Or another one, I think, where it's more challenging is when someone comes in that has a history of an eating disorder. Not even somebody who's currently actively suffering from an eating disorder, because that's front and center. If they've come and they put it on their paper, they're at the stage that they can talk about it and they're actively working with a therapist and they are taking steps that are already in place. That's pretty structured. It's for people who have sort of resolved the acute phases of their eating disorder, but it's still there, and it makes it more challenging to be direct about healthy eating, taking doses and not omitting doses because you don't want to own up to the fact you ate something, or not wanting to keep detailed records for a few days so we can do great basal testing and carb ratio adjustments, because there's so much potentially shame or guilt or those other negative emotions that get really big when you're really focusing in on your diabetes education and adjustments and things. So I think those are, I don't know that they're odd, but they're challenging for me and for the clients. That's why they sign up for visits, so we can navigate through together.
Sure.
Yeah, they really kind of work against each other, right? Because when you're trying to resolve disordered eating, you're trying to not count and measure everything, right? But then insert diabetes, that if you're trying to really dial it in, you're doing counting, measuring, weight. Like it's a conundrum to be in. It is not.
And they'll typically, if they aren't already working with a healthcare provider that they know is well-versed with type 1, then I will pause and say, I really highly recommend go see Kristi, go see Anna, because you want this with your diabetes, and this other area is a struggle. And we need to find a way to connect them so that we can get you what you're trying to achieve. There's a way. And I think
love that we have such a nice multidisciplinary team here at Integrated Diabetes, and it allows us to bounce ideas off each other, gain the expertise from each other. But let's have a little fun with our teammates. We work with a fairly eclectic group of type 1 CDCESs. So I just want to get your opinion. which member of the IDS team would be the first to die if there was a zombie apocalypse? I'll tell you mine. I think it would be Nancy, our office
That's who I was
manager.
thinking of. Oh no, poor Nancy.
Only because Nancy is terrified of horror movies. She's never seen, she doesn't know. You gotta get the brain. You gotta stab the brain to kill them. And I can't see her surviving very long in that kind of environment. You agree with me, Tavia?
That's who I thought of first. And I thought, do we have to limit it to the CDCESs or can I pick Nancy?
It could be
Poor
anyone
Nancy.
on the team. Kristi, who do
Well,
you think?
I would add myself. Nancy and I will be the first ones to go because I don't do horror either. So we would probably both be paralyzed, frozen in fear, and they'll just get two at a time.
Fair enough. When you think of a type A personality, who on the IDS team comes to mind first?
Me?
Tavia?
It's me?
I would agree. I concur with that choice.
Maybe Jenny is my second runner-up.
Maybe Jenny too, maybe.
Right? Who do you think has the best culinary skills?
Maybe Dana, only because I've seen more pictures of Dana's cooking events. So what do you think, Kristi?
Dana, sure, she gets the award.
I'll take Jenny only because Dana's in Texas and Texas cooking is odd. I don't know. Jenny's done some pretty creative stuff from that standpoint.
Does. That's true.
Who do you think has the best sense of humor of anybody on our team?
That's a tough one. I feel like one of the things I really enjoy about our team, besides the important things for doing our job well, right, is how much humor we can throw into whatever we're dealing with. I really appreciate Alicia's. It's strong. It just pops into any moment. She can just, there's some stress or we're hyper focused. It comes in and I can't stop laughing.
I think you can be very funny too, Gary.
Yes.
Thank you.
That's true.
I was thinking Alicia.
Yeah.
She breaks
I would
me up
say between
sometimes.
you and Alicia, yeah, you definitely can bring the comedy factor.
Think of competition. Who on our team would win an arm wrestling contest?
Well, I would never go up against Alicia.
Gosh, but Anna does all of that, like P90X, kettlebell. I don't know. I bet it would be Anna.
I was thinking Anna and Catherine.
Yeah.
Catherine's in good shape. She used to be she could lift a truck. I mean, that girl is strong.
Oh, some secret ninjas on the team. I was not.
Who do you think is most organized on our team? Kind of goes with the type A personality. Tavia?
I give the illusion of being organized. Certain things are extremely organized in my life.
Nevertheless, whether it's the illusion or not, you're organized.
I would say Jenny as well. Like if she stops and tells you all of the things she's doing in a day, you have to have things in order to do all of those things. So, yeah.
Who would you most like to get drunk with?
I need a new question. I don't want to get drunk. But maybe Kristi, because Kristi was just talking about that earlier, I guess.
I'm going to have an adult beverage with a friend later this afternoon, pre-national holiday. But I'm a lightweight, but I was thinking you, Tavia. It would be really fun to watch the two of us barely get through probably one adult beverage and
share one.
Yeah, we'll share one. Can you pour it into 2 glasses?
Yeah, I would love to see Kristi drunk just to get you to open up. But Dana, I think, would be a lot of fun. She's fun to begin with.
Yeah.
Probably just fall asleep. Not that I couldn't get a little wacky, but
if there were dancing involved, then I wouldn't fall asleep. But I'm with you, Kristi. If we're sitting down and we're talking and it's relaxed, you get more than a drink in me than I gotta go.
Happening. Yeah, we keep some food flowing and yeah.
Okay, fair enough. Okay, now there are some rapid fire. Just get your quick responses to these. So first, when it comes to finger stick glucose monitoring, lick or wipe?
Wipe.
Wipe.
Gross.
Lick. I
Oh
never,
gosh, no.
never.
Ah,
I have lovely friends that I watch lick and they are in the medical field and I don't understand, but to each their own, no judgment,
Right.
but
DIY or commercial system?
DIY.
DIY, but again, not
Depends on the
everybody.
situation.
There's
Yeah.
some
DIY. This is
Yeah.
you personally. What you
DIY.
recommend?
Yeah.
Coffee or tea?
Coffee.
Coffee.
Tea is lovely. Coffee wins.
Diet soda. I don't like hot drinks, so
Oh,
I'll abdicate from that question. Mountains or prairies? Who came up with these?
Beaches
beaches.
or tropical rainforest. That's what I'd pick. So
Kristi?
neither.
I would do mountains. Mountains or beaches. I mean, anything. Prairies are beautiful, but yawn.
But I live in a prairie, sort of.
You
So
live in a prairie.
Yawn.
I'll take bike trail.
Mhm.
Let's see. Favorite color for a pump?
I would say turquoise or bright yellow, like a metallic bright yellow.
Kristi, you got a color?
Purple or like invisible. Can it just,
Transparent.
or just, be non-existent.
It could be like a hologram, like when it changes the light, then it changes the color. I would do that.
That's pretty high tech. I would take a Philadelphia Eagles midnight green color. I use that color in a lot of my house painting. Debbie's always on me for that. But best concert you ever saw?
Gosh, that's a tough one. Because it was a long time ago when I saw it. So I have to think. I think probably Boys to Men. Loved that.
My whole image of you is blown. Boys to Men? Okay. All right. Kristi, what do you got?
I saw the Cranberries at an amphitheater area in Michigan, and that was pretty phenomenal.
Okay. I'll take Stevie Ray Vaughan. Incredible show. Favorite snack?
Popcorn.
I don't have one. How do you have one favorite snack?
Come on.
Okay,
You're
I really
watching
like.
Boys to Men. You're hungry. What are you eating?
Oh, how about what I eat at home at night? Snack of popcorn or the little packets of trail mix that have a variety of different kinds of nuts and dried blueberries and little pieces of chocolate. Yeah, I like that.
I like those Jack's cheese curls. Those are great. Your favorite low carb snack?
Low carb? I don't eat low carb. No, I'm kidding.
I don't have one.
A cheese stick? I mean, I like cheese, so cheese stick. Or
veggies and hummus. I don't know.
Yeah, that's good. Some
you
carrots.
Can tell this is a carb-loving crowd.
Yeah.
Yeah.
I like carrots. All right, staycation or foreign travel? What do you like?
What foreign travel?
I'm not much of a tourist. I don't like looking at sites and touristy things. But I like to travel. I like to see new places, but not looking at touristy stuff.
I say foreign travel and eat the food in the different places. That's what I like that.
Now you're talking.
And seeing the different landscapes or different.
Do a food tour of the world.
Yeah, that would be good.
Okay. Excellent.
All right. Favorite kind of movie? Is it horror? Is it comedy, drama, or like a Hallmark movie?
Documentary or comedy?
I like the genre of, what do you call it? Organized crime movies, like the Godfather type.
Mm-hmm. What about you, Tavia?
Drama and suspense that's not gory. Keeps you on the edge of your seat.
Well, I feel like I know you two so much better now, and I'm glad we had a chance to spend some time discussing this stuff. I'm a little scared about what our colleagues on our team how they're going to answer some of those questions that we asked before. I can't wait to see the podcasts with them on them. But those will be coming out. Ours comes first, so we get to say and do whatever we feel like. But thank you both for joining in. Kristi Baguayo, who provides counseling services for our patients, and Tavia Vital, who is a bilingual CDCES and nurse and does an outstanding job with all levels of patient care, including all the high-tech stuff that's available now, the open source systems. And we didn't even mention, Tavia, you also have a son with type 1, so you're very in touch with the needs of parents and family members of those with type 1.
Yep.
And mention the program that you run for support people.
We have a timeout for caregivers, and it meets every couple of months. It's free, and it's a space where parents can come to see other parents face-to-face virtually and get that support that you need, because most parents are doing this really on their own, and it's just a safe space. We usually have a focus area that we plan to talk about, but also we open it up for questions or frustrations or things that are coming up that parents might be nervous or whatever the emotion of the day is. It's where we meet together and kind of work through this thing together.
And how much does it cost to participate?
$0.
That's a good price. I like that.
That is a good price.
And I'll give people a discount on that if they need it.
Yeah, just ask Gary for the discount.
Got it. All right. Well, again, thank you, Kristi and Tavia, for joining me today. Links about that program will be in the show notes. And I'm Gary Scheiner, reminding everyone out there to keep thinking like a pancreas.
Thanks for tuning in to Think Like a Pancreas, the podcast. If you enjoyed today's episode, don't forget to like, follow, or subscribe on your favorite podcast app. Think Like a Pancreas, the podcast is brought to you by Integrated Diabetes Services, where experience meets expertise, passion meets compassion, and diabetes care is personal because we live it too. Our team of clinicians, all living with type 1 diabetes, understands the challenges firsthand. We're here to help no matter where you are in the world. From glucose management to self-care strategies, the latest tech, sports and exercise, weight loss, type 1 pregnancy, and emotional well-being, we've got you covered. We offer consultations in English and Spanish via phone, video chat, email, and text. Want to learn more? Visit integrateddiabetes.com or email info@integrateddiabetes.com to schedule a consultation. On behalf of Think Like a Pancreas, the podcast, I'm Gary Scheiner, wishing you a fantastic week ahead. And don't forget to think like a pancreas.